Good afternoon. My name is Preet Bharara, and I'm the U.S. Attorney for the Southern District of New York. Today we announce criminal and civil charges against 3 individuals and 2 pharmacies for allegedly flooding the city with hundreds of thousands of illegally diverted oxycodone pills, a highly addictive and dangerous painkiller. At the heart of this massive prescription painkiller distribution business was Chopin Chemists Pharmacy, operated out of 2 locations, one in Brooklyn and one in Queens. As alleged, Chopin Chemists indiscriminately sold so much oxycodone that for 3 straight years, from 2010 to 2012, its Brooklyn location was the number 1 purchaser of oxycodone in the entire area covered by that zip code, one that even included several national pharmacy chains. In 2011 and in 2012, that Brooklyn pharmacy purchased close to 250,000 more oxycodone pills than the second highest purchaser. This prescription pill problem that is now at epidemic proportions around the country is being fueled by the illegal diversion of prescription pills by corrupt doctors and pharmacists and the street-level dealers who work with them. Today's law enforcement actions, both criminal and civil, strike, we hope, at the heart of what has been one of New York's largest sources of diverted oxycodone pills. As alleged, the defendants illegally distributed more than 500,000 tablets of oxycodone over a 5-year period, pills with a street value of between $10 and $15 million. The indictment alleges that Lillian Wykowski, the owner of Chopin Chemists and a licensed pharmacist, along with her husband, Marcin Jakacki, sold oxycodone pills out of the Chopin Chemists pharmacies every which way they could. Some pills they sold based on stolen and fraudulent prescriptions, including many made out to fake names like Chanel and Coach. Other times, they just sold oxycodone without asking for prescriptions at all. For example, out of 760,000 oxycodone pills distributed out of the Brooklyn location in a 2.5-year period between 2011 and 2013, DEA's audit found that 430,000 had been distributed without any prescriptions whatsoever. Robert Cybulski, the third defendant, was one of Chopin Chemists' best customers. Cybulski alone allegedly bought tens of thousands of oxycodone pills, visiting the pharmacy several times a month and usually leaving with over 500 pills at a time with no prescription or plainly fake ones for illegal distribution. As also alleged, illegally selling these massive quantities of oxycodone made Wykowski and Jakacki rich, earning them enough to buy a $2 million home in Greenwich, Connecticut. All 3 defendants, along with Chopin Chemists pharmacies, are charged with conspiracy to distribute narcotics. Wykowski and Jakacki are also charged with laundering the proceeds of their illegal narcotics business. Wykowski is further charged with conspiracy to misbrand prescription drugs and a separate offense of defrauding Medicare out of more than $750,000 by claiming reimbursements for medicine she never actually dispensed. In addition to these criminal charges, we have filed today a civil complaint against Wykowski and her pharmacies to recover millions of dollars in civil penalties from her illegal drug sales and from her Medicare fraud. With these actions, we believe we have shut down one of the largest illegal prescription pill mills in the city. Whether it is the corrupt doctor writing unwarranted prescriptions, the greedy pharmacist selling pills based on fake or no prescriptions at all, or the street-level drug dealer peddling painkillers directly to the addicted, we have to confront this escalating epidemic at every level. Our actions today show that we and our law enforcement partners are committed to doing just that. And that's why I talk about this as much as I do, and I know the DEA and other folks do as well. I'm joined here today by our partners in this and so many other important cases. The DEA, represented here by Acting Special Agent in Charge James Hunt. We are also joined by the IRS Criminal Investigations, represented by Tom Bishop, Special Agent in Charge of the New York office. Also, Naomi Gruhas, the Assistant Special Agent in Charge of Health and Human Services, Office of the IG in New York. And I want to thank all of them for their efforts over time on this case. I also want to commend the outstanding work of the career Assistant U.S. Attorneys in my own office who worked on this case. Assistant U.S. Attorney Sid Kamaraju, supervised by Jessica Ortiz and Jessica Masella, the chiefs of our narcotics unit, as well as Assistant U.S. Attorney Tony Pellegrino, supervised by Pierre Armand, Rebecca Martin, and Chris Harwood, the supervisors of our civil fraud unit. And before I turn the podium over to my partners in this law enforcement effort, I want to say a few words about prescription pill abuse generally, and then preview a public service announcement that we hope will be aired soon. The illegal diversion of prescription painkillers is not only a federal crime, as we have charged today, but really a national health crisis. And I repeat these statistics over and over again because they're worthy of repeating and because more people need to know about it. More Americans die from prescription pill overdoses than from heroin and cocaine overdoses combined. Drug overdoses generally were the leading cause of injury deaths in the country in 2013, surpassing even car accidents. According to the Center for Disease Control, every day, about 44 people die from prescription painkiller abuse. That means one almost every 30 minutes. Every day, another 7,000 people will end up in emergency rooms around the country from prescription pill abuse. And prescription painkillers have proven to be a gateway to heroin and other opioid addiction. So much so that recent studies have shown that heroin abuse is 19 times more likely among those who have reported non-medical use of pain relievers than those who have not. And often it's the case that it's easier to get a heroin fix than to get an oxycodone pill. We recognize that this is a problem that we can't just prosecute our way out of. Education and public awareness needs to be a big part of the solution. In all manner of work that we do, whether you're talking about public corruption or terrorism or gang violence or corporate fraud, public awareness and getting to root causes is an absolutely essential part of protecting the public and preventing these bad things from happening in the future. So to that end, I and a number of other folks have gotten together and recorded a public service announcement. One that we'll preview in a moment for you features myself, Manhattan District Attorney Cyrus Vance, and Special Agent in Charge James Hunt. It reflects our collective view that we need to do more than just prosecute cases to confront this healthcare problem that is killing too many people in our communities. So if you just indulge us and bear with us, we can play the PSA. The death toll from prescription painkillers has tripled in the last decade, and the problem is getting worse. Over 16,000 people die each year from prescription painkiller overdoses. That's more than the total from heroin, cocaine, and all other illegal drugs combined. My name is Preet Bharara, and I'm the United States Attorney for the Southern District of New York. Prescription drugs are highly addictive and can be just as dangerous as any street drug and just as deadly. Many teens who begin abusing prescription drugs turn to heroin for a cheaper high. Do you have any unused prescription pills at home? Would you know if some were missing?
My name is James Hunt, and I'm the Special Agent in Charge of the Drug Enforcement Administration, New York Field Division. Every day, 2,500 teens take a prescription drug to get high for the first time. All over the country, they're getting lured into believing that a prescription pill is safe to take by just anyone, and 65% of teens are getting these drugs from a medicine cabinet at home or from a friend or relative.
My name is Cy Vance, and I am the Manhattan District Attorney. There are a few simple steps you can take to keep these drugs out of reach. Keep your prescription drugs away from your kids, and keep track of how many pills you are using. Dispose of your unused, unwanted, or expired prescriptions safely, and if you know of doctors or pharmacists filling or filing false prescriptions, contact law enforcement.
And talk to your children about the dangers of prescription drugs.
Because we've seen too many kids die young.
And you're the best line of defense for your own child.
For more information on the dangers of prescription drugs and what you can do to protect your family, visit these websites. Is it over? Okay. So we plan to release this PSA along with a companion PSA that we recorded with the Rockland County District Attorney Tom Zugby shortly, and it should be available on our website. At this point, let me bring up James Hunt from the DEA.
Thank you. As U.S. Attorney Bharara told you, the public service announcement is a part of law enforcement's effort to battle the insidious whole prescription drug abuse and heroin addiction have over the Northeast and the rest of the nation. Not only embracing a public awareness campaign, we are focused on cutting off the suppliers, be it traditional prescription drug dealers and heroin traffickers, those who have forsaken their role in the medical community, like rogue doctors, rogue nurses, and rogue pharmacists. As stated earlier, this investigation began as a regulatory audit of one pharmacy, which uncovered a massive pill mill operating out of two mom-and-pop pharmacies in Queens and Brooklyn. Lillian Wykowski was the owner and pharmacist at both these pharmacies. Mind you, a pharmacist's responsibilities include a range of care for patients, from dispensing medications to monitoring patient health and progress. Wykowski did the exact opposite, using her position to sell hundreds of thousands of oxy tablets to dealers for further resale on the street, fueling opiate abuse and addiction. From DEA's perspective, Wykowski is nothing more than a white-collar drug dealer. Today's arrests highlight how multiple agencies, each with their own forte, come together to charge these three defendants on both criminal and civil charges. I'd like to recognize and thank the Southern District of New York for the diligent efforts. I would also like to thank all the other agencies involved in this investigation. The Tactical Diversion Squad of New York, comprising agents and officers from the DEA, NYPD, New York State Police, Westchester Police, and Town of Orangetown Police Departments, in addition to Health and Human Services and the Internal Revenue Service. Thank you.
I want to call to the podium Tom Bishop of IRS.
Good afternoon. My name is Thomas Bishop, and I am the Acting Special Agent in charge of the New York Field Office of IRS Criminal Investigation. I'm privileged to stand here today with my colleagues from the U.S. Attorney's Office, the DEA, and Health and Human Services. And I'd just like to commend all the employees of these various agencies for a great job. As the law enforcement arm of the Internal Revenue Service, IRS Criminal Investigation is responsible for investigating criminal tax fraud and related financial crimes, including money laundering, which at its core facilitates the underground economy and in turn harms our nation's tax system and financial strength. As financial investigators, IRS Criminal Investigation brings its financial expertise to money laundering investigations of all types. Our special agents are second to none in their ability to trace the flow of illegal proceeds through the U.S. and global financial systems. The abuse of oxycodone and other prescription drugs has become a crisis in our society, and like our law enforcement agency partners, we are using our specialized skills to fight this epidemic. In this investigation, among other things, we traced the proceeds of the oxycodone sales to the purchase of a $2 million home. As a law enforcement agency, IRS Criminal Investigation remains committed to the investigation of illegal drug operations, including those who illegally traffic in prescription drugs. Any profitable drug organization depends on the laundering of illegal proceeds in order to remain successful and to operate undetected by law enforcement. We are proud of the proven track record of using financial investigations to dismantle such such organizations as this. The fact that an organization may be an otherwise legitimate medical practice, pharmacy, clinic, or medical facility, or the seller may be a doctor, pharmacist, or other medical professional is irrelevant. In addition to participating in narcotics investigations, our money laundering mission takes us into the realm of healthcare fraud, often in the interest of protecting the funding for public programs like Medicare, which ultimately come from the nation's tax system. Here we trace the flow of fraudulent Medicare reimbursements allegedly used by the defendants for personal expenditures and to fund their illegal oxycodone operation. Together with our agency partners, IRS-CI stands ready to lend its expertise in such matters. We look forward to speaking more about this indictment in the future as this investigation unfolds. Thank you.
Thank you. Happy to take your questions. Yeah.
Yes, all pharmacies have to be licensed by DEA, and they're subject to regular audits. So in answer to your question, that's how this was uncovered, through a regular audit. I'm sorry? What? Well, Bureau of Narcotics Enforcement from the state of New York has a system to track that, but they were buying these pills from a lot of them from the pharmaceutical companies. What didn't match up was the scripts to go with them when we did the audit. Yes, because when we did the audit, that's a civil action. When we did the audit, it spooked them. They closed down the one pharmacy, started operating more out of the other pharmacy in Queens, slowed down the pace. They were still able, we were still able to make a criminal case on them. We had undercovers purchase prescription pills from the pharmacies, but it's a two-step process. It's regulatory first, civil, and then you have to make a criminal case. You have to show a pattern. I'm sorry, last part of your question? We don't have any information on fatalities or overdoses. That's an awful lot of pills to sell. So, in answer to your question, there was dealers coming there and buying scripts. So they could be as much as 120, 400 pills. Some users buy pills and feed their own addiction, and others are just straight out dealers who buy them. So in this case, it was both. It started with a regular audit by DEA's diversion group, which regularly audits pharmacies, doctors. When they uncovered that there was pills out of the pharmacy that didn't match up with prescriptions, that's when a criminal investigation began. Not that I know of. He's from Staten Island, and basically he was selling fraudulent scripts to the pharmacist. No, selling them. Well, it's certainly out of the ordinary when a small pharmacy would sell more than a CVS or a Rite Aid in the same area. So this business is about greed. You know, when you're that greedy and that much of a discrepancy shows up, it shows how greedy they were. Yes.
You know, I think it's being paid for out of funds that are earmarked for the purpose, so we can get you the answer to that. As I've said repeatedly, part of our job is to make sure the public is safe. And part of the way you make the public safe and you engage in prevention, as the Attorney General does, as the President does, as every district attorney that I'm aware of, worth his or her salt does, is to talk about the problems that lead to the kinds of conduct that affect people's lives and cause them harm, whether it's financial harm or physical harm or medical harm. And so at the same time that people talk about drug abuse and drug problems, it is not only appropriate, but I think in some ways compelled to talk about why it's important so that people understand and have a public awareness about what some of the harms are. I don't think there's anybody ever who announces a drug case or announces a gun case or announces a violence case publicly only to talk about the particulars of that case. The reason that we announce things publicly, the reason you come, John, the reason that people come and the reason the cameras come is so that the public understands the importance of the issue, so people can take action to protect themselves, and other people who are thinking about engaging in the bad conduct will think twice about engaging in that conduct, because we don't have the ability to be everywhere in all places and find all the bad guys in every context that's important in our docket. So one of the ways you do that is by talking about the cases you bring, and then separately and appropriately talking about what the impact of that is, so the community understands that these are important things. Now, the PSA, by the way, is a public health PSA. It goes to parents and directed to parents and teachers and other people in the community to make sure that they understand that extra pills that are lying around are a problem. And I think you wouldn't have come and paid attention if we did just the PSA. Yeah. Yes, yes. I think, yeah. There are public prosecutors who have repeatedly spoken publicly about public health issues. I believe that the U.S. Attorney in Boston has done a very substantial public service announcement on Medicare fraud and healthcare fraud, and that happens in other parts of the country as well. There are lots of people who can talk about this. I had a conversation with the Surgeon General of the United States, also with the drug czar, so-called drug czar, the head of ONDCP, and they make public statements and they talk about these problems also. And I think I mean, people can make the arguments that they want to make. I think it's perfectly appropriate and, in fact, incumbent upon me to do so. Yeah. I believe 2 of them were arrested in Greenwich last night, and the 3rd in Staten Island last night. And I think they're going to be presented before Judge Francis this afternoon. Yeah. I don't know. We don't know yet. Yeah. Yeah, I think it's a combination of things. I think some people, it's accidental, and it can be both. You can both be taking them illegally and it be an accidental overdose. And I think there's a large number of them. And I think you have the gamut of circumstances when you're talking about 16,000 a year.
The answer is yes.